In this video, I'm going to talk about the allegation that you failed to collaborate with your coworkers. And I have seen a few of these cases. This is not as common as some other types of complaints, but it does come up, and it has been coming up more lately. And what it involves is working with other people within your organization. So there's a lot of reasons why nurses sometimes fail, or it's alleged that they fail to collaborate with other professionals. So the most common example I can think of is when a nurse is not following orders or goes beyond the borders of what they were asked to do and takes it upon themselves the decision-making process. So this is a very nuanced area. So for example, if a doctor tells a nurse what to do, the nurse is supposed to do it, right? But what if the doctor is asking the nurse to do something that is clearly not appropriate? Well, then the nurse has a duty to question it or to bring the concerns to the charge nurse or to the director of nursing. But many nurses feel intimidated by a doctor and sometimes don't question their decision, and that's a problem too. But more often, the problem is that the nurse fails to follow the instructions of a superior. So it cuts both ways, and only careful training will know when you should question versus follow through on the orders given. Now, there are sometimes when nurses act when they should be getting orders. So the first case I remember was a new nurse who restrained a patient using wrist restraints. The patient was trying to pull the various tubes out after a post-surgical condition. The nurse was new and needed to restrain the patient from pulling all the tubes out and should have contacted a doctor, because as we know, the rules about restraints has become much more carefully restricted and requires usually a doctor's input. And she failed to call the doctor because it was 2:30 in the morning and she didn't want to bother the doctor. So that's an example of, not collaborating. There's a bunch of situations. Another common one, I don't know how to resolve this one very well, but it's where a nurse is overworked, has too many patients assigned to him or her, and they need to reach out and ask for help from the charge nurse or the director of nursing. And this is something that nurses, some don't do. They just suck it up, and then mistakes are made. So collaboration is a very big thing. It's very important that nursing teams work together, that the CNAs help the nurses, that the nurses follow the two sets of protocols. One is, what is the nurse practices? And then the second level is, what does that employer require? Another pitfall I see nurses do is they're used to doing it a certain way at one facility. When they go to another facility, there's a different set of rules and requirements. And it's important to follow these, even if they go above and beyond the requirements of nurse practices or another employer. It's important for the nurse to find out what those new rules and new protocols are and to follow those to avoid an allegation of failure to collaborate with other medical professionals.